The campaign from Safer Consumption Sites here in Ottawa to speak about community support for this initiative.
Hi everyone, thank you all for coming out. I really appreciate the displays of support. The campaign for Safer Consumption Sites was created in 2011. We're a grassroots organization of community members who advocate for the creation of a facility like the one being demonstrated here today. Our group has organized several public forums with speaker panels of experts and community discussions around the city over the last 2 years. In the spring and summer of this year, CSCS volunteers went door to door to residents in Lowertown and the Byron Market, providing information on supervised consumption services and gathering feedback on a short questionnaire. Now we have copies of our 8-page report available around, and hopefully everyone, I'm not sure if we have enough for everyone, but we'll have it definitely online as well if you don't get a copy today. 8-page report of all of our findings that we're bringing out. We found that we canvassed about 115 residences in this area, and 76% of the people said that they thought a supervised drug consumption site should be opened in Ottawa. And we also visited businesses in the Byron Market, speaking with business owners, managers, and senior staff about drug use in the community and community health in the neighborhood. 78 people responded to our survey, and of these 78, 73% said that they thought a supervised drug consumption site should be opened in Ottawa.
I was a respondent in that survey, and I taught surveying for 30 years at Ewald. If my students that did a survey like that, they get an F. It was one of the most biased collection of data that I've seen. You really can't tell.
We're not an academic organization or a grassroots organization, and so we're going around and asking people their thoughts, and as well as providing information to them. I think we've found that there's been great support. We talk to people, there's a dialogue. We didn't reach everyone
Folks, listen, but there's going to be ample opportunity to discuss. So let's just finish the formal program, and then we can open it up for discussion and debate. Okay? Let's keep this really respectful.
Okay. Yeah, let's keep it honest.
So we're very pleased to hear that there's such an overwhelming support, and the majority of Ottawans believe in this cause. The results demonstrate that people who live and work in the neighborhood affected by problematic drug use, obviously there's some detractors, but they actually care about the people in this neighborhood, and they care about addiction, and they care about the human rights of everyone in the community, not just because you're addicted to something are you forced to be cast aside. People, I think, in Ottawa have a lot of care for others and less fortunate around them. And to address the HIV, hepatitis C, and overdose deaths in this community, this is a very needed, proven method to fix those problems.
That's not true.
It's time to heed the call from this community and to take action to establish supervised drug consumption sites in Ottawa. Thank you very much.